Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're talking about when not to wear compression garments. This is a really important video for those with lymphedema who have to wear compression on a frequent basis, because unfortunately in the clinic I often see people who have been prescribed compression garments which they shouldn't be continuing to wear because of the symptoms they're experiencing with those garments. And there's quite a fair list of what constitutes why someone shouldn't continue to wear a compression garment. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below if you have any questions on compression garments. So I'd just like to make a point, guys, that the information in this video is dedicated to those who are wearing compression garments on their upper limb. So if you have lymphedema in your lower limb, then the information in this video may not necessarily apply. The reason I'm pointing this out is that there are contraindications in the lower limb if you have certain things like vascular disease, particularly arterial disease, as to why you may not be allowed to wear a compression garment. But in this video I really want to focus on arm sleeves, because the large majority of people that are watching this channel will be those that have suffered breast cancer, which generally means they're going to have lymph nodes removed from their armpit, which then also means, of course, that they're at risk or they have contracted lymphedema in their upper limb. So I just thought I'd point that out. So the first reason that people should not continue to wear a prescribed compression garment is if they get what we refer to as neurological symptoms. So this is specifically pins and needles or numbness. And most of the time, if people are going to get these symptoms, it will generally occur in the hand. Doesn't always have to occur in their hand, but that's most of the time what's going to happen. So if you're getting tingling, numbness, or just generally altered sensation for prolonged periods, then I would definitely say that the compression garment you've been prescribed is too tight. So I'll just give you an example of a compression sleeve. So what I wanted to point out here, guys, is that this is a compression sleeve that stops at the wrist, whereas other compression sleeves like this one also include a section that will cover the thumb and a little bit of the hand up into the knuckles. So I'm going to refer back to an important point about some differences to take into account with the two styles of compression garments a little bit later on. But the main thing I wanted to mention when it comes to neurological symptoms is that sometimes when people first put on a compression sleeve, they may feel symptomatic changes in their hand. Now, what we often will see is coloration changes, and we may also have patients who do experience some light tingling in their hand. So what we often encourage people to do is open and close their hand for a couple of minutes at least, 2 to 3 minutes of doing some opening and closing at the hand. And sometimes the reason people experience these symptoms when they first put the garment on is due to blood flow changes. So not so much mechanical pressure on nerve tissue that's causing so much constriction that you're going to have permanent pins and needles or permanent numbness if you continue to wear the sleeve. But sometimes it's just the fact that the sleeve's just gone on and the compression of that sleeve has altered some blood flow. So if you've been doing this movement for a couple of minutes and your symptoms go away, then you can continue to wear that sleeve. But if those symptoms do not go away, then it is most likely that sleeve is too tight for your arm. The second reason to discontinuing wearing a compression arm sleeve is if you experience pain when you wear the sleeve. So any increase in pain is not going to be a healthy thing, particularly in the context of your lymphatic system. So there are patients I've had in the past, bless them, who have tried to persist with wearing a compression garment even though it is hurting them. So I try to make it very clear to patients that if wearing their arm sleeve is causing pain, then that is not the right fit. It can be for a number of reasons why arm sleeves can cause pain, but at the end of the day, if you're experiencing pain with an arm sleeve, then that is not the right arm sleeve to wear. It's actually quite common that patients will present to my clinic with a poorly fitted compression arm sleeve, and unfortunately what does happen is that despite the fact that sometimes arm sleeves are fitted to patients by a lymphedema therapist, they're not being educated well enough as to what you should not have to put up with from a compression sleeve. So as we started with in this video, pins and needles and numbness is number one, and then certainly number two is pain. So if you have any concerns about whether or not you are meant to be tolerating certain symptoms with a compression sleeve, please double check with your lymphedema therapist, and if you're really not confident that you are being told the correct information, then seek a second opinion. So if your arm sleeve is causing pain, then it is definitely time to remove that sleeve and get another one fitted. Unfortunately, it is the case that I think a lot of people have poorly prescribed compression sleeves, or they've gone out and chosen their own arm sleeve and they may not have the financial means to go and get a second sleeve. But at the end of the day, you're actually going to cause yourself more long-term problems if you persist with an ill-fitting sleeve than if you wear no sleeve at all. Obviously, in the context of lymphedema, compression is still very much gold standard. So I'm not saying don't wear compression, but I'm also saying that it is worse off if you're wearing an ill-fitting garment. So as we started with in this video, if you have pins and needles, numbness or pain, it's definitely time to get another arm sleeve. If people persist wearing a compression sleeve when they are experiencing pain, it usually leads to worse outcomes in terms of their lymphedema. So they can get worse swelling if they are wearing a sleeve and they're trying to persist wearing that sleeve despite the fact that they've got pain. So for all the lymphedema therapists out there, please encourage your patients to remove the sleeve if it is causing the limb pain. The third reason you should stop wearing a compression sleeve is if the compression arm sleeve is causing increased swelling, but particularly increased swelling in this region of the hand, which is called the dorsum of the hand. And this is a big problem when it comes to lymphedema therapists prescribing compression garments, but also generally people wearing compression sleeves. So the problem here is that often this is the style of compression sleeve that is prescribed, and these compression sleeves stop at the wrist. Now, one of the biggest problems, and this probably happens a little bit more for women rather than men, is that women usually have quite tiny circumferences at their wrist. Now, if you think about it, because lymph fluid is all around the body and is continually meant to be flowing around the body, I think the problem comes about because we've got quite a large surface area here that's got to be bottlenecked to get through this tiny little area of the wrist and then continue on through the upper limb and back into the central part of the body. Now, if you have a compression sleeve that stops at the wrist like this one, if this section is too tight, you're going to cause lymphatic blockage at the wrist. So this is probably one of the most important things you can keep a close eye on when you first get a new compression sleeve, is make sure that it does not cause any swelling of the hand, but also swelling of the fingers at that. So if you notice swelling of the hand or fingers, and regardless of the style of compression garment you're wearing, if this occurs, remove the compression sleeve, because it means that the fit around your wrist and or hand is not good enough. So please take the garment off if you notice any signs of swelling at the hand or fingers. I should put a note in here, guys, to really hone in on the fact that fitting of compression garments is quite tricky. I've been doing it myself for close to 7 or 8 years now. My mentor has been doing it for 27 years, and we still both get some minor problems when it comes to perfecting particularly custom compression garments. And the only reason I want to point this out is that unfortunately everyone's quite different in their circumferences and lengths, and sometimes you can go through 1, 2, 3, 4 sleeves sometimes before you get a really good fit. It's not just the measurements either. It's also the style of fabric that you tolerate. It's the class of compression that you tolerate. It's all sorts of factors with the sleeves that can make or break a really well-fitted sleeve. So just keep in mind that if your first sleeve fails, that can be quite common. So it's unfortunate and it's frustrating, but believe me, it's absolutely worth persisting with. If you've got lymphedema and it needs to be well managed, it is really worth your effort to try and get the best possible fitting sleeve that you can, because otherwise it's likely that your lymphatic system will have issues going on with an ill-fitting sleeve. And like I said before, it's not that I'm saying don't wear any compression at all, but certainly wearing no compression compared to wearing poorly fitting compression you're going to be better off wearing no compression in that circumstance. The fourth reason we should stop wearing a compression arm sleeve is if the sleeve is too loose. Now that might sound ridiculously simple as a concept, but it's something important to point out, because even though we don't want a sleeve that is too tight, which is potentially going to be intolerable for the patient, but also it may cause lymphatic blockage, we also don't want a sleeve that is not firm enough, because a sleeve that's too loose is not going to be effective. So just make sure that when you're fitted for a compression sleeve, that it doesn't have really obvious areas where there's no compression, because that's going to lead to a lack of compression, which is going to lead to an ineffective sleeve. So the point here is that if you're going to put the effort in and wear compression garments if you've got lymphedema, then you want to make sure that whatever garment you're actually wearing is effective. If you've got a sleeve that's too loose, it's not creating a compression gradient to push that lymph fluid back towards the center of the body. In the same way, if you've got a sleeve that's too tight, that's causing lymphatic blockage, it's going to be intolerable for you and it's going to be ineffective in the opposite way. So make sure that when you get fitted for a compression sleeve that it is not too loose. The fifth reason we want to stop wearing a compression arm sleeve is if we have any sort of skin reaction to that arm sleeve. Now, most arm sleeves do come with what we call a grip top, which is a little band around the top of the garment, this section here, and the design is meant to help hold the sleeve up against gravity so that you're not continually having to pull the sleeve up during the course of the day. Now, unfortunately, there are some people who do have a skin reaction to this grip top. There's different grip tops on the market and they're made out of various materials, but when you do get fitted for a compression sleeve, just keep an eye on the skin around where that band sits, particularly around the inside of the arm, because this part of your arm, of course, can be resting against your body and friction can be created. The other area we want to keep an eye on is the inside of the elbow. So I have seen people get skin breakdown at the inside of the elbow just because there's a lot of traffic movement at the elbow because of what we have to do during the day. Now, interestingly, there are certain compression garment companies like Haddenham Healthcare as an example that can put silk liners into custom garments. So this can be included in a custom garment where they put a little silk patch on the inside of the garment. I'm doing this for a lot more of my custom compression garments these days because a lot of people will tell me that they get an irritated bit of skin at the crease in the elbow, and unfortunately, regardless of your skin quality, this can be normal, again just because of the high traffic of movement at this joint. So if you wear a compression garment and you're getting skin breakdown at either the inside of the elbow or the top of the arm where the grip top is sitting, we definitely need to consider a different style of grip top, or we need to put in silk liners, or just in general the features of your arm sleeve need to be changed. Some patients we see may have skin that is too fragile to have a compression sleeve fitted. So there are other options on the market such as compression wraps, or just very lighter styles of fabric that certain patients need if their skin is too fragile, because if you put a compression sleeve on, you've really got to create a fair amount of pulling and drag across the skin. So if you've got someone whose skin is particularly thin, fragile, prone to breakdown, it may not be the best thing to fit them with a compression sleeve that is this style of compression sleeve. You may need to consider other options in that circumstance. Thank you so much for watching this video, guys. I hope you've gained some great information about when not to wear compression garments. I hope you're having a great week wherever you are. I'll be back for the last time this year next week with another video. Can't believe we are nearly at Christmas for 2021. I'm Jen McKenzie, the breast cancer physio, and I'll see you next time.